Hello, my name is Joe Reagan, and I work as an occupational therapist with Select Physical Therapy here in Pensacola. Very often I'm asked what is the difference between an occupational therapist and a physical therapist. The main difference really is that an occupational therapist is going to work mainly with upper extremity and with utilizing functional types of tasks in order to achieve goals, whereas a physical therapist would use more of like an exercise-based treatment program to achieve essentially the same means, but they just may be working with different pathologies. During a typical day for me, I basically just evaluate and treat patients. I work mainly with hands, so I work with the elbow, wrist, and hand. And so a typical day would be maybe I get an arthritis patient that has had like a joint replacement in the thumb. I may evaluate that person, and based on what the doctor has on his script, I'll probably make a splint for that person and then have them follow more of like an active range of motion program until we can do strengthening when that's cleared by a doc or by a physician. But that's like a typical work day for me is between 8 and 10 hours a day. I like to keep it and try and keep it at 8, but that doesn't always happen. But 8 to 10 would be typical. In terms of job requirements for becoming an occupational therapist, from an education standpoint, you need the field has shifted to the point now where most of the programs are either master's level programs or they are doctorate, and that's where we are in today's field. In terms of the educational requirements for what you want to take for courses, you want to be exposed to as many, I call them the ologies. You need to be exposed to as many like biology, anatomy, physiology, kinesiology, pathophysiology. The more that you can be exposed to these types of core classes, the better off you'll be, and the better prepared you'll be to go into this field. Bachelor's degrees. If a person were going to go into occupational therapy, going into the master's or the doctorate level, you would want to pursue mainly like exercise science, any degree where you're going to be focusing in the sciences. Getting a bachelor's in kinesiology would be a very good way to go as well. But any degree where that bachelor's is in science and it's in, like with kinesiology, it would be addressing, like how the body moves, so it'll better prepare you down the road. An exercise science degree is kind of the same thing where you're learning a lot about like exercise programs, how the body moves, how it responds to training, those types of things. So I think those two degrees would be good baselines. Now with licensure, in order to become certified in a state, if you're practicing in, we won't name any states, but say you take a board exam, you're licensed to practice in that state. And if you wanted to move to another state, then you just find out what you need to be licensed and to practice in that state, because it may vary. It's going to be mainly similar, but it's going to vary a little. But once you've gone through your the master's or the doctorate level that you're trying to achieve, at the end of any of those programs, you'll go to an internship. And typically an internship is going to be about 6 to 8 months on the road, where you'll go to different clinical settings to start to apply what you've learned during your classroom time, and then during your level 1 internships. where a level 1 internship is where you're basically just going into a clinic and you're observing, which prepares you for your internship and your level 2, where you're going in and you're basically just going in under your clinical instructor and learning from and practicing under their license, which is how it works. The best and worst parts of this type of job, start off with the positive, which is the best. The best part of this job, and for me the most fun part of this job, is watching someone get better. I have always, in all the years that I've been practicing, that is the thing that excites me the most, is when a person is getting better, or when you contribute to a person that is getting better. And so I suppose if that's the best part, the worst part might be just the opposite, where maybe you have a person, or you're working with a patient who's not as compliant, or they're not dialed into the program that you want to do with them, or you want to work with them, and they, for whatever reason, they just don't follow through, or they don't completely just sort of participate. And that is probably the worst part, because then you get, instead of the good outcome, you get the opposite. You get maybe a poor or a bad outcome, and that's just not fun. It's not a good part of the job. But other than that, I'd have to say that'd be the thing that I think is the worst. My final advice to a person that wanted to get into this field is really try to make a very informed decision about which way you want your career to go. Because it is a long process going through a master's or a doctorate level degree. So there is a lot of commitment there, and you wouldn't want to get 3 or 4 years into it and say, I don't think I want this. So I would say really know that you want to get into it. Volunteer before you get into your program, so that way you have exposure to the program that you want to go into. So that way you're getting a feel, so to speak. I think one of the greatest things about working within this field, the advantages to being in this career, is that there's so many avenues to pursue. If you wanted to work with older folks in geriatrics, you can do that. If you want to work, if your slant is pediatrics, you can go into pediatrics. You can work in hands. You could work in a sports clinic. You can work in a nursing home or a hospital or a rehab center. And for that reason, down the road, there's so many advantages to employment that you're only limited by your imagination, because you could find a setting that works for you, that is set for you, basically. So.